My name is Dr. Tayal. Pleased to meet you.
Oh, yes.
I've been asked to have a look at your hands.
Yes.
Do you want to tell me what's the problem been?
Yes, I've had Rayner's phenomena for some years, but I've noticed they've been getting worse.
Right.
Really cold, and the circulation's been really bad. And now I'm noticing a lot of these small contusions here,
Okay.
whatever they are,
Yeah.
which are very, very painful.
Are they? Okay.
And
So how long have you had this problem in your hands for?
I've had these particular ones probably a couple of years, but they've been getting worse as we've gone along.
And when you say Raynaud's, what do you mean?
I've had the Rayner's probably be about 10 years or more.
What do you mean when you say Raynaud's? What symptoms do you get in your hands?
Well, the cold, going red and white and blue very often.
All right. Okay.
And so painful.
Painful as
More
well.
painful than anything. And swollen.
Swollen as well.
I think my hands are really quite swollen now. And they're going...
Have you had any ulcers in your fingers? Tips?
Yes, I have had ulcers.
Okay.
I've had... These seem to be pretty bad at the moment.
Yeah. Yeah. Do you get joint pains as well in your hands?
Right.
Do you get pain in your joints, like
Oh, I
knuckles
do,
or
yes. Yes, I do. Particularly these joints here.
Yeah, yeah. Your thumb looks quite out of shape there.
Yes,
yeah.
it is out of shape as
Yeah.
well.
Okay.
Yes.
Right. What about the knuckles? Do you get pain in your knuckles?
They're not too, but they can be, yes. If I've been working on something, I do find the pain is the whole hand seems to be painful.
Do they feel stiff in the morning?
Yes, very stiff in the morning.
How long does the stiffness last for?
Well, probably takes me a good half hour to get them moving, and if I can shake them about a bit and get them going again.
Have you noticed any skin changes?
No, I don't think so.
Any skin changes in where?
Oh, I can't pinch. The skin's tight, I think. The skin seems to be going tighter.
Tighter.
Yes.
Okay. Just over the hands or over the rest of your body as well, over the forearms?
Well, mostly
arms?
there, but I do get problems with the elbows as well, which, they seem to have sort of almost like an ulcer on, particularly on this one. It's just my hands seem so swollen and large, really.
Large as well, yeah.
Yes.
Any cough?
No cough.
Any breathlessness?
Yes, I do get breathless if I try and walk too far. My legs ache a lot, and I have to stop.
Okay, and how far are we talking about? In yards, how many?
Well, I probably have to stop after about, less than 100 yards, I would think.
All right. Okay.
Yes, and have a rest and do a bit more.
Any difficulty in swallowing?
Yes, I do have difficulty in swallowing. I find if I've eaten something perhaps with a crust on it, it will get stuck.
Okay. Do you get heartburn?
A little bit, but it feels more like the food sticking. I can feel when it's moving down again.
Okay.
So I have to tend to take smaller meals.
Okay. And your bowels? How are your bowels?
Bowels, a bit troublesome, but perhaps because I can't eat enough, really.
Do you have any diarrhea?
No diarrhea.
Off and on diarrhea.
No.
Any previous medical problems that you know? Diabetes, blood pressure?
No.
No.
Got low blood pressure, if anything.
Heart disease?
No diabetes.
Do you smoke?
No, never smoke.
No.
Not drunk either.
No. Okay. Okay, let's have a look at your hands. So you've got these sort of healed ulcers, and that's just... Yeah. Okay. Right, just looking at your mouth. And put your tongue out for me. Yeah. Fine. I'm just going to listen to your chest and heart.
Right.
Yeah. And take a deep breath for me, in and out, please. And out. And again. And out. And again. And out. Just going to listen to your heart now.
Okay, you have 2 minutes remaining.
After examining your hands and listening to your story, it looks like obviously you have had Raynaud's for many years, and that's affecting your circulation in the fingers, and that's causing the ulcers and the infection that you've probably had in these fingers. Now, also examining your skin, it's quite thick and tight, and that's what we call a condition called scleroderma, where there is excessive deposition of collagen, which is one of these substances, which causes loss of elasticity. So that's why the skin becomes very tight. Unfortunately, it can also affect the internal organs like the lungs, kidneys, bowels as well. And we have to look into this because you're complaining of breathlessness as well. So we want to make sure that it's not affecting your lungs.
Right.
So what I suggest we do today is we do some blood tests. We do some chest x-ray, and we'll arrange a special scan for your heart as well as for your lungs to look for any scarring in your lungs and your heart. We'll do some breathing tests, and I'll give you this information leaflet. Regarding what to do about this Raynaud's, you're already on the amlodipine tablet.
Yes.
Are you wearing gloves?
Yes, I do. I wear gloves all the winter and indoors the house as well.
Yes. Sometimes heated gloves, battery operated gloves are
Yes, you can do, yes.
Are you applying some cream, because sometimes applying the cream will make the skin more healthy? And
yes, I tend to put some moisturising cream on it if I can. I don't know if there's anything extra I can do.
Yeah. Unfortunately, we can't do anything for the, if the ulcer develops or if the new ulcer comes, then we can give you some treatment for this. But at this moment in time, the skin looks all right. The ulcers are all healed, but we have some treatment available.
What sort of treatment is that?
It's one of the medications we give sort of to open up the circulation, to help with the circulation. Yes. But that's only given when you have severe painful ulcers which don't respond to other treatment. Right. And as I said, because we have to keep you under review to look for whether the internal organs are affected, we'll just follow you up every so often, and we'll do these scans and get the results. And see you later, yeah? Do you have any questions you want to ask me at this stage?
No, I mean, is there any cure for it?
Unfortunately, there's not one single treatment which is effective at this stage.
No.
Yeah. Okay, thank you so much.
Okay.
Please discuss your findings and diagnosis for this case.
My diagnosis for this patient is limited cutaneous systemic sclerosis. She also has severe involvement of carpometacarpal joint of both her thumbs. My findings are she's got digital pitting with some healed digital ulceration, a history of Raynaud's phenomenon, few facial telangiectasias. She has sclerodactyly on the dorsum of her hands, but there is no skin involvement of her forearms. There is no evidence of pulmonary fibrosis or loud P2, so there is no evidence of pulmonary arterial hypertension.
And how would you like to investigate this patient?
I would like to do baseline blood tests, check her urine dipstick for proteinuria and hematuria. I would like to check her blood pressure, do heart tracing, an ECG, a chest x-ray, do an echo on an HRCT of the chest to look for pulmonary fibrosis. I would also like to obtain a full pulmonary function test for this patient. Systemic sclerosis or scleroderma can be, it's a common station in PACES examination, and sometimes it's not fairly obvious, so it's important to keep it in mind while examining hands. And the diagnosis then become obvious looking for telangiectasias, nail changes, digital pitting. It's important to show to the examiners you're looking for digital pulp atrophy as if you were looking for clubbing, and to also ask the patient to open the mouth if the patient has inability to open the mouth, which is microstomia. Sometimes it's useful to look for telangiectasias in the mucous membrane. We should also look for pulmonary fibrosis by listening to the chest, check the heart sounds, looking for a loud P2, check for pedal edema, and obviously the history would include a history of ulceration involving the fingertips and Raynaud's phenomenon.